Morning, all of you. Today I will discuss about the topic is rheumatoid arthritis. First of all, discuss about the learning objectives of rheumatoid arthritis. Based on the content in this chapter, the reader should be able to like introduction of rheumatoid arthritis and etiology and pathology of rheumatoid arthritis, and third one objective is clinical features of rheumatoid arthritis, and next one objective is investigation of rheumatoid arthritis, and last one learning objective is management of rheumatoid arthritis. These are the learning objectives of rheumatoid arthritis. Next one is learning outcomes of rheumatoid arthritis. By the end of the lecture, the student should be able to understand like introduction of rheumatoid arthritis and etiology and pathology of rheumatoid arthritis and clinical features of rheumatoid arthritis and investigation of rheumatoid arthritis, and last one learning outcome is management of rheumatoid arthritis. These are the learning outcomes of rheumatoid arthritis. First of all, discuss about the introduction of rheumatoid arthritis. Rheumatoid arthritis is a chronic systemic autoimmune disorder. Rheumatoid arthritis is a chronic systemic autoimmune disorder caused by symmetrical polyarthritis. Causing a symmetrical polyarthritis. First one is autoimmune disorder. What is autoimmune disorder? A disease in which the body immune system attacks healthy cells. It means autoimmune disorder, and a chronic inflammatory disorders affecting many joints, including those in the hands and feet. And next one is symmetrical polyarthritis. What is symmetrical polyarthritis? Symmetrical arthritis affect the uh, same joints on both sides of the body, such as knee and wrist joints, also known as symmetrical polyarthritis. Next one is epidemiology of rheumatoid arthritis. Rheumatoid arthritis affect 0.5 to 1% of the population. Rheumatoid arthritis affect 0.5 to 1% of the population worldwide, and with a peak prevalence between the age of 30 and 50 years. Next one is etiology and pathogenesis of rheumatoid arthritis. Etiology and pathogenesis of rheumatoid arthritis. First one, gender. According to gender, women's before the menopause. Women's before the menopause are affected three times more often than men with an equal sex incidence. Thereafter, suggesting an etiological role for sex hormones. First one, menopause. Menopause, a natural decline in reproductive hormones when a woman reaches her 40 or 50 years. And next one is familial. Familial, there is an increased incidence in those with a family history of rheumatoid arthritis. Familial means in and is an increased incidence in those with a family history of rheumatoid arthritis. And genetic factors. Genetic factors human leukocyte antigen HLA. HLA means human leukocyte antigens and DR4 and HLA DRB1, HLA DRBN B1, HLDR4 and HLA-DRB means these are the gene-provide instructions for making a protein that play a critical role in the immune system. And HLA is a part of family of gene called HLA complex. Next one is pathology of rheumatoid arthritis. Rheumatoid arthritis is characterized by synovitis with thickening of the synovial lining and infiltration by inflammatory cells. Infiltration by inflammatory cells. Synovitis or synovial inflammation is the when synovium of joints become inflamed, swallow, and synovium is connective or synovial stratum is connective tissue that line the inside of the joints. And next one is generation of new synovial blood vessels is induced by angiogenic cytokinins. Generation of new synovial blood vessels is induced by angiogenic cytokinins. Angiogenic cytokinins means these cytokinins and chemoattractants are secreted by immune regulatory cells but also by tumor cells, tumors associated macrophage and stroma, stroma cells, stomata cells. Next one is activated endothelial cells. Activated endothelial cells produce adhesion molecules and vascular cells adhesion molecules first. Adhesion molecule. Adhesion molecule, the cell adhesion molecule are a subset of cell adhesion proteins and located on the cell surface and involving in binding with other cells or with the extracellular matrix in the process called cell adhesion. And vascular cell adhesion molecule first, VCAM. VCAM means vascular cell adhesion molecule first, and which expedite extrusions of leukocyte into the synovium. Leukocyte extrusions of leukocytes, also commonly known leukocyte adhesion cascades or diapedesis, is the movement of leukocytes out of the circulatory system and towards the site of tissue damage or infections. Next one, the synovium proliferate and grow out over the surface of cartilage. The synovium proliferate and grow out over the surface of cartilage and producing a tumor-like mass called pannus. Producing bony wall, producing a tumor-like mass called pannus. Cartilage. Cartilage is a type of connective tissue. Cartilage is a type of connective tissue found in the body, and cartilage is a unique tissue type because it doesn't have blood vessels or nerves. And pannus. Pannus is a type of extra growth Painus is a type of extra growth in your joints that can cause pain, swelling, and damage to your bones and cartilage and other tissues. It's most often results from rheumatoid arthritis. Painus destroy the articular cartilage. Painus destroy the articular cartilage and subchondrial bones and producing bony erosion. Next one, this is the diagram of synovial joints and rheumatoid arthritis and venous formation between the joints. Next one, this is the diagram of normal joints and this is the diagram of rheumatoid arthritis joints. In which normal joints, this is the capsule and this is the synovial membrane and this is the synoviocytes and cartilage. And early stage of rheumatoid arthritis was the angiogenesis and neutrophilisis pills and dendritic cells, T cells, and B cells are accumulating the synovial fluid. And rheumatoid arthritis established means plasma cells, bone erosions, and venous neutrophils accumulate in the joint fluid. Next one is normal joint, and this is the osteoarthritis, and this is the rheumatoid arthritis. These are the bone erosion and swollen inflamed synovial membrane and thin cartilage and bone and rubbed together. This is normal and arthritic joints. Next one is chemical book. Next one is clinical features. Clinical features of rheumatoid arthritis. One, onset of pain, early morning stiffness, onset of pain, early morning stiffness lasting more than 30 minutes, and swelling in the small joints of the hand and feet. As the disease progresses, there is weakening of joint capsules, and joint instability, subluxations, and deformity. Next one is rheumatoid arthritis late stage, and this is the bout, area and deformity of thumb and ulnar deviation of metacarpingeal joints and swan neck deformity of fingers. Next one is non-articular manifestations of rheumatoid arthritis. Non-articular manifestations of rheumatoid arthritis. Non-articular means, sorry, non-articular means affecting or involving soft tissue can cause and connective tissue rather than joints. Non-articular rheumatic disorders and systemic non-articular manifestations of rheumatoid arthritis is fever, fatigue, and weight loss. Fatigue means feelings overtired, and non-articular affecting or involving soft tissues and muscles and connective tissues rather than joints. Non-articular rheumatic disorders and eyes, scleritis and scleromalacia, perforation of eyes. Scleritis is the inflammation in the sphygmal and several tissues with injections in both superficial and deep epiaxial vessels of eyes, and perforations. Perforation, a corneal perforation means that the cornea has been penetrated, thus leaving the cornea damaged. And cornea responsible for the focus. Next one is neurological non-articular manifestations of rheumatoid arthritis, carpal tunnel syndrome, and atlantic axial subluxations and cord compressions. Carpal tunnel syndrome, a numbness and tingling in the hand and arm caused by a nerves in a wrist, and atlaxial subluxations is a malignant of a first and second cervical vertebra which may occur only with neck flexion, and cord compression is a spinal cord compression. Cord compression is a spinal cord compression when a mass places pressure on the cord. A mass can include a tumor or bone fragments. Next one is hematological non-articular manifestations of rheumatoid arthritis. Lymphadenopathy. Lymphadenopathy is a immune system glands that usually enlarge in response to a bacterial and viral infections, but sudden swelling or many lymph nodes are indicated cancers. And Felty syndrome. Felty syndrome is usually described associated with a complication of rheumatoid arthritis, and disorder is generally defined by the presence of three conditions. First one condition is rheumatoid arthritis, and second one condition is enlarged spleen, splenomegaly, and last one condition is low white blood cells neutropenia. Next one is spleno hypersplenism. Hypersplenism. Hypersplenism is a overactive function of spleen, and thromboly- thromboto- thrombocytosis means increase thrombocytosis means increased number of platelets in the blood. Next one is pulmonary pleural effusions and lung fibrosis, rheumatoid nodules, and rheumatoid pneumoniasis. Lung fibrosis. First of all is pleural effusion. Pleural effusion, a build-up of fluids between the tissue that lines the lungs and the chest. And next one is lungs fibrosis. Lungs fibrosis that occurs when lungs tissues become damaged and scarred. And next one is heart and peripheral vessels. Heart, heart and peripheral vessels like pericarditis and pericardial infections and rheumatoid syndromes. Pericarditis means infection between the layer of heart, and pericardial effusions and rheumatoid syndromes. Next one is vasculitis. Rheumatoid syndrome, a condition in which some areas of the body feel numb and cool in certain circumstances. And next one is vasculitis. Vasculitis is inflammation of blood vessels that cause change in the blood vessels wall. And next one is kidney. Amyloidosis was the nephrotic syndrome and renal failure. Amyloidosis, the buildup of amyloid protein in the heart, kidney, liver, and other organs. Next one is normo, normochromic, normochromic. Next one is investigation of Investigation of rheumatoid arthritis. First one investigation test is blood count. Usually is normochromic, normochromic and normocytic anemia, erythrocyte sedimentation rate, and C-reactive proteins are raised during the rheumatoid arthritis. Normochromic anemia is a form of anemia in which the concentration of hemoglobin in RBC is within the standard range, and CRP, C-reactive protein, is a measure the level of C-reactive protein in your blood. And next one is serum. Next one is serum autoantibodies. Anti Anticyclic citrullinated peptide has high specificity 90% and rheumatic factor is positive in 70% of case, sensitivity 50% for rheumatoid arthritis, and X-ray so joint narrowing erosion at the joint margin and synovial fluids high neutrophil count in uncomplicated disease. Uncomplicated disease. Next one is radiology. This is the normal hand bones, and this is the rheumatoid arthritis bones. Bone erosion between the feet and bone displacements. This is shown under the radiology. Next one is fates. This is the normal fates, and this figure is rheumatoid arthritis foots and dislocations of twice. Rheumatoid arthritis, knee nodules. Next one is differentiating features. Differentiating features like rheumatoid arthritis was in young small joints and autoimmune disease and synovial inflammation, and last one is synovium means cartilage. Cartilage is a connective tissue. And next one is osteoarthritis. Osteoarthritis was old age and large joints and degenerative cartilage degenerations and synovium. So cartilage and synovium. This is the osteoarthritis. Next one, criteria for the diagnosis of rheumatoid arthritis. Criteria for the diagnosis of rheumatoid arthritis and American College of Rheumatology 1987 revision and 4 6 weeks or more. More than 1 hour morning stiffness and arthritis of 3 or more joints and arteries of hand and joints and wrists and symmetrical arthritis and subcutaneous nodules. Subcutaneous nodules and Subcutaneous nodules are deep-seated lesions in the skin and located in the deep dermis and subcutaneous, often within minimal changes appreciated on the surface of the skin. And next one, a positive serum rheumatoid factors and typical radiological changes, erosion, as first articular osteopenia. Osteopenia means boneless, a condition that occurs when the body doesn't make new bone as quickly as a reabsorbed old bones. This is the erosion and articular osteopenia. Next one is complications of rheumatoid arthritis. Complications of rheumatoid arthritis like ruptured tendons and ruptured joints means Baker's cysts and joint infections. Next one complication is spinal cord compressions and atlecconchial and upper cervical spine and amyloidosis rarely and side effect of therapy. These are the complications of rheumatoid arthritis. Next one is management of rheumatoid arthritis. What is the management of rheumatoid arthritis? No treatment cure rheumatoid arthritis. No treatment of rheumatoid arthritis and goals are the remission of symptoms and return of full functions and maintenance of remission with disease and modifying agents like effective management of rheumatoid arthritis require a multidisciplinary approaches. These are the management of rheumatoid arthritis. These are the drug of choice for rheumatoid arthritis. Non-steroidal anti-inflammatory drugs and toxic drugs. These drugs are effective in relieving the joint pain and stiffness of rheumatoid arthritis. And corticosteroids treat the suppression disease activities. And next one is disease modifying anti-rheumatic drugs DMARDs, disease modifying anti-rheumatic disease factor, act mainly through inhibition of inflammatory cytokines 6 weeks to 6 months of disease onsets. And these drugs are included in the disease modifying anti-rheumatic drugs like sulfasalazine and methotrexate. These are the disease-modifying anti-rheumatic drugs used in the treatment of rheumatic arthritis. Next one is sulfasalazine is used in patients with mild to moderate disease. Sulfasalazine is used in patients with mild to moderate disease and for many is the drug of choice, especially in younger patients and women who are planning a family. And next one, the methotrexate is the drug of choice for patients with more active disease and contraindicated in pregnancy in steroidogenic. And last one is leflunomide. Leflunomide blocks T cell proliferation. Next one is azathioprine, called intramuscular or oral hydroxychloroquine, and penicillamine are used less frequently. The less frequently drugs are used in the treatment of rheumatoid arthritis like azathioprine, gold hydroxychloroquine, and penicillamine used it less frequently. All drugs have serious side effects of rheumatoid arthritis. Next one is references of rheumatoid arthritis. First one reference is Clinical Pharmacy 10th edition 2010 by P.M. Bennett, and second one reference is Clinical Pharmacy and Therapeutics 5 September 2011 by Roger Walker, Catavithlesia. And next one reference is Pharmacotherapy, a pathophysiological approach, DIPRO 7th edition. And next one reference is Essential of Medical Pharmacology, KD Tripathi 5th edition. And next one is Basic and Clinical Pharmacology, Bertram G. Kurjan, 11th edition. And next one is Reagendale Pharmacology, 6th edition. And Pharmacology and Pharmacotherapeutics, R.S. Sotagar, 20th edition. These are the references for rheumatoid arthritis. Next one is multiple choice questions of rheumatoid arthritis disease. First one question is what are early signs and symptoms of rheumatoid arthritis? What are early signs and symptoms of rheumatoid arthritis? Option A is Option A is joint pain, tenderness, redness, and swelling. And option B, loss of joint range of motions. And option C is limping. And option D is all of the above. The right answer is D, all of the above. The early signs and symptoms of rheumatoid arthritis like joint pain, tenderness, redness, and swelling, and loss of joint range of motions, and limping. These are the signs and symptoms of rheumatoid arthritis. Next one question is rheumatoid arthritis is different from some other forms of arthritis because it option A is more painful than other forms. Option B occurs below the waist and option C is symmetrical affecting the right and left side of the body and the right answer is the option D is generally occurs above the waist. The right answer is C is symmetrical affecting the right and left side of the body. Next one question. Rheumatology is the branch of medicine. Rheumatology is the branch of medicine that involves the study of the option A is the immune system, option D is musculo, musculoskeletal muscles and bone systems, and option C rheumatic disease, and option D all of the above. The right answer is D. Rheumatology is the branch of medicines that involve the study of the immune system, musculoskeletal system, and rheumatic disease. These are the branches of medicine of rheumatology. Next one question. The sudden appearance of worsening of rheumatoid arthritis symptoms is referred to as an option A is outbreak, option B is flare, and option C is burst, and option D is European. European. The right answer is B. Flare is a sudden appearance or worsening of rheumatoid arthritis symptoms is referred to as flare. Next one question. The terms arthritis refer to option A is stiffness, option B is stiffness in joints, option B is inflammation of the joints, option C both A and B, option D none of the above. The right answer is B. Inflammation of the joints are referred to term arthritis. Next one question. Rheumatoid arthritis is more severe in option A is man, option B is woman, option C is both A and B, option D is none of the above. The right answer is B. Women are more severe in rheumatoid arthritis. Next one question. Peoples with rheumatoid Peoples with rheumatoid arthritis experience the most stiffness at night. Option A is true. Option B is false. The right answer is B. False. Rheumatoid arthritis experience the most stiffness at night is false. Next one question. Rheumatoid arthritis can be treated by option A is medication, option B is exercise, option C is surgery, and option D is all of the above. The right answer is D, all of the above. Rheumatoid arthritis treated by medication, exercise, surgery. Next one question is which test cannot be used to aid in the diagnosis or monitoring of progression of rheumatoid arthritis? Option A is ESR, option B is RF test, next one is NTCD test, option D is hydrophil AB test. The right answer is D. Hydrophile AB test is can't be used to aid in the diagnosis or monitoring of progression of rheumatoid arthritis. The next one question is the cause of rheumatoid arthritis is a option A is heterophily antibodies, option B EBV antibody EBV, and option C is immunoglobulin M, and option D immunoglobulin G. The right answer is C. Immunoglobulin M cause rheumatoid arthritis. The right answer is C. Next one question. Which test cannot be used to aid in the diagnosis or monitoring of progression of rheumatoid arthritis? Option A is ESR, option B is rheumatic factor test, option C NTCD, and option D hydrophile antibody. The right answer is D. Hydrophile antibody cannot be used to aid in diagnosis or monitoring of progression of rheumatic arthritis. Next one question. The cause of rheumatic arthritis is option A is hydrophile antibodies, option B EBV test, and immunoglobulin M, and immunoglobulin D. The right answer is C. Immunoglobulin M cause of rheumatic arthritis is. Next one is thank you. Thank you all of you for a wonderful session.